Okay, well, we'll go ahead and get started here. For those of you that don't know me, my name is Bobby Horner. I am the dietitian at Odom Health and Wellness. And today we are going to be talking about prediabetes and then prevention of it turning into diabetes. So a very big topic. I think we'll learn that this is very prevalent in people. A lot of people don't even know that they may have prediabetes. So it's an important topic that sometimes I feel like doesn't get talked about enough. And the thing is, the reason why I talk about it a lot is because nutrition is probably one of your biggest things, biggest lifestyle focuses that you can be doing to prevent prediabetes or diabetes, or if you have, kind of right on that verge of it, kind of turning it around and getting your lab levels back to normal. So we're going to talk about first, what is diabetes? So type 2 diabetes is much different than type 1 diabetes, remember. So we're not talking about type 1 diabetes today, just type 2. So it's an impairment in the way the body regulates and uses sugar, or another name for sugar is glucose, as fuel. So there's lots of long-term chronic effects of this, of too much sugar circulating in your bloodstream. Remember, we do need some sugar in our bloodstream. About a teaspoon is what we say. But a lot of times people have way too many just from different foods that they're eating too. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune system. So in other words, your body does not use insulin properly. And we'll talk more closely about what glucose and insulin are too. And so you become insulin resistant is what we say, which means that the hormone insulin is being released by your body, but it is not able to enter into your cells, which leaves you with high blood sugars. So what is insulin? So it's a hormone that comes from a gland called the pancreas. It's released when we eat carbohydrates or sugars. So the pancreas secretes the insulin into the bloodstream. It circulates, enabling the sugar to enter your cells. So insulin lowers your blood sugar. It lowers the amount of sugar in your blood. So as your blood sugar levels drop, so does the secretion of insulin from your pancreas. So then the other thing is, and then the role of glucose. So glucose, or sugar, is a source of energy for the cells that make up muscles and tissues. So glucose comes from two major sources. It comes from our food, in particular carbohydrates and sugar. So a big point of that you guys will get across too today is that all carbs digest as sugar in our body. So it does not matter if it's what we still call, a good carb or a bad carb, or healthy carb, not healthy carb, whether it's a piece of fruit, it's a piece of bread, it's rice, it's a candy bar, all carbohydrate, any food that's considered a carbohydrate, when it hits your system, does really digest into sugar. So that is what raises a blood sugar. Doesn't mean we don't eat carbs, and we'll get more into that, but that's why we talk about different types of carbs a lot, because it affects how fast or slow a food may break down in your system. So we get it from food, and then our liver also stores glucose. So sugar is absorbed into the bloodstream where it enters cells. Like I said, your liver stores and makes glucose. So if a blood sugar drops, your liver is able to make glucose to keep your blood sugars within normal range. The thing to remember is that everybody's blood sugar goes up and down a little bit, but if somebody is pre-diabetic or diabetic, they're having big fluctuations in their bloodstream, in their blood sugar, and that's what's causing the issue. Their body cannot bring that blood sugar level back down to normal, and you're chronically running high. So what are some of the effects that we might see from insulin resistance? Your heart starts to take a big toll. So it's very hard on all of the organ systems. You might get high blood pressure. You'll get elevated triglycerides. You can start to get your low your good cholesterol. Your HDL may be too low, and your LDL may rise. Of course, you start to get elevated blood sugars. A big thing that people notice is they get an increase in their abdominal fat. They start to gain around that midsection area. And then they also get, urinary frequency, lightheadedness, bloating, heartburn, constipation. A lot of different things can come from this. And so if we look at, and we'll look at more of those side effects too to look for, but who's at risk? So one of the biggest risk factors is being overweight or obese. So our weight has a big toll on this. And so that's why we'll look at kind of the diet and exercise piece of things throughout the presentation. Also where we hold our body weight. So if we're storing mainly in that abdomen region, that's where we store insulin to begin with. And so if we're noticing an increase in weight there, more than likely we're starting to get a little bit of insulin resistance going on. So insulin is a fat storing hormone. Same thing with, if you guys have heard of cortisol or stress hormone. Cortisol is also a fat storing hormone. And those are kind of our two hormones that actually we have the most control over through the foods we eat and how we manage stress, which is easier said than done. But yeah, you can see there waist circumference over 40 inches or 35 for females. Inactivity, so the less active you are, the greater risk you have. Physical activity, it doesn't only control your weight, but it also uses up the glucose or sugar in your system. So if we're not active and we're eating a lot of carbohydrates, your body has nowhere to put those except for to store them, and then it's floating around in your blood sugar on your bloodstream as well. So activity helps burn off that sugar. If you have a family history of type 2 diabetes, once again, different than type 1 diabetes, you are at definitely an increased risk to get it. So that just means that it doesn't mean you'll get it, but you just have to be a lot more diligent going forward than somebody that maybe does not have a risk factor in their family for it. Race and ethnicity, it's unclear why, but different races are more prone to diabetes, type 2 diabetes. Also, if you look at your lipid levels, if you have a low good cholesterol or HDL, and you have high levels of triglycerides, you are going to be more prone. The reason being is triglycerides, if those are high, those are very linked to the amount of carbohydrates and sugars we have in our diet. So if triglycerides are high, a lot of times it's showing us that your body is not tolerating the amount of carbs that are coming in through your diet, or you're not burning them off enough. Age also, unfortunately, as we get older, everything, we become more susceptible to everything, but especially over the age of 45. Prediabetes can turn into diabetes, which we'll talk about. Pregnancy, if you had gestational diabetes, you are more prone. If you have PCOS, also more prone because your insulin, it's kind of a whole different talk, but you have irregular menstruation, and then you are also more insulin sensitive. Also, if you start to notice areas of darkened skin, usually in the armpits or neck, this often starts to indicate early signs of insulin resistance. So you should have that checked out. Other things are if you have high levels of inflammation in your body, you have a very sedentary lifestyle, high amounts of stress, also, which we won't get into a stress talk, but stress also raises our blood sugar levels. And so that's why we're always talking about managing stress. If you also have other hormonal conditions like hyperthyroidism, Cushing's syndrome, you can be more prone to it as well. Or if you've been exposed to a lot of toxins, viruses, or harmful chemicals, once again, because those are a stress on the body. So stress affects it. And obviously when you put different stressors on the body or in the body, it can cause those things to happen. And certain medications can too. So like I said, type 2 diabetes is very common. And so a lot of times we just don't talk about it a lot. But 30+ million people in the US have diabetes. Here's the big factors that around 7.2 million do not know that they even have it. They're walking around with it, but their blood sugar is all over the place and they don't know. And so it's a test that we should always get done. And I'll talk a little bit more about what tests we should be doing too. So that's about 10% of the population has type 2 diabetes. So I'm sure if you don't have it, maybe you could definitely know somebody or a family member that has it. And the big thing is that numbers continue to grow as unhealthy lifestyles get more and more common. We get more and more sedentary. Most of our jobs are sitting all day, and we get more and more hooked on convenience foods a lot of times through busy lifestyles. So symptoms of type 2 diabetes, you could have increased thirst, frequent urination, extreme hunger. When I get patients that are like, I'm never full, I could eat like every hour. That's a lot of times an indicator. Unexplained weight loss, or actually a lot of times for type 2 diabetes, it's weight gain. Like I said, weight gain around that midsection area. Fatigue, irritability, sometimes people get blurred vision. They'll get energy highs and lows or kind of feel like they crash, or we'll get low blood sugars where they almost get kind of shaky or like have to eat or drink something to bring that blood sugar back up. You get slow healing sores. You can also get frequent infections. such as like skin infections. Women might get more vaginal infections, gum infections. And then once again, those areas of darkened skin you can also get. So sometimes symptoms come on very gradually and we're not really aware of them. We just think, oh, maybe we're getting older, or maybe I've had a lot of stress, or I'm not sleeping well. And so sometimes we don't pay attention to symptoms the way that we should, because like I said, they can be so gradual at times. So how do we diagnose type 2 diabetes? The test that is probably most often used is called what we call a hemoglobin A1C. That is, so if you get just a glucose test done, that's a one-time marker of what your blood sugar was at that time of the test. A hemoglobin A1C is what is a average of your last 3 months of what your blood sugar was doing 24 hours a day. So it's a good test to see, okay, in morning, night, where has your blood sugar been? So below 5.7% is normal. If you're between 5.7 to 6.4, that's prediabetes. Some doctors have brought it now down to like 6.2 as considered to be a true type 2 diabetic. So the range is getting smaller for some doctors. And so it just really depends on the practitioner that you see too. So if you're at like that 5.8 mark, if you've had an A1C down, you really want to start to get diligent, because it doesn't mean that your prediabetes is going to turn into diabetes. You can make lifestyle changes. This is one of those things that we can really turn around those numbers, and you'll start to see those come down through diet and exercise and lifestyle. Otherwise, I'll tell you, you don't want to get diabetes, and then it's controlled by a lot of medications and things. So, but you can control your diabetes through nutrition a lot of times. Other options or other tests that they might do is just a random blood sugar test. They might do a fasted blood sugar test to see if you have not eaten within 12 hours, where your blood sugar is at. If it's still high, so high would be considered, so a normal blood sugar is between like 80 and 130. So if your blood sugar is way above that and you haven't eaten for 12 hours, there's more than likely they're going to do some more testing for you. And then there's an oral glucose tolerance test, which is they give you glucose and they see how your body responds to it. If you spike up really high, like let's say over 300, more than likely they're going to further test you for diabetes. So I always say that this A1C test is a test that everybody should be getting done if they're over the age of 40. If you are overweight, if you have any family history of diabetes, you should be getting your A1C checked yearly, definitely. And then what will happen is if your A1C is high, a lot of times the doctors will give you, 3 months to make some lifestyle changes, meet with a dietitian, get on a good exercise program. And then they may retest you to see if there's been any changes in that 3-month mark. So how do we manage our blood sugars? So first, and we'll get more into these in detail, but obviously eating a good diet, right? Which is easier said than done. Eating a healthy diet can be difficult. It's hard to make diet changes a lot of times, and some people don't know what to do. So I always encourage you to meet with a dietitian to figure that out. Also monitor your blood sugars. So everybody reacts to foods differently. So I have patients that if they eat popcorn, their blood sugars may spike really high. I have another patient who might eat popcorn and it doesn't really affect their blood sugars. So I encourage you to really be monitoring those blood sugars, and you can see, okay, what foods, even if they might be healthy foods like a piece of fruit, may be spiking your blood sugars a little higher than you thought. The big one is lose weight. So if you are overweight, lose even 5% of your body weight can make a huge difference in how your body is able to regulate its blood sugar levels. So it doesn't have to be extreme weight losses. Even little changes make a big difference. If you lose 5 pounds, 10 pounds, that can take a lot of stress off the body. Start on an exercise program. We're going to talk about that a little bit more. The reason you want a combo of weights and cardio, the reason being, once again, it helps use up the glucose in the system. Also, if we are inactive for long periods of time, if we sit for long periods of times, actually our insulin level rises. So a lot of people don't know that, whether we've eaten or not. So it's just your body's insulin and cortisol will rise. So we want to be getting up every 30 minutes. So if you're someone that works at home or has a desk job, I have a lot of patients that actually set like an alarm on their computer or their phone to get up and go fill up their water bottle, go use the restroom, just to get up and move around a little bit. Find ways to manage stress. Like I said, stress will drive a blood sugar up. and getting adequate sleep. So sleep is a big one. Sleep is important for everything, and that's a whole nother talk. But if you are waking up a lot during the night, or you're not sleeping well, so one night of bad sleep will affect how you digest carbs the next day, and actually how you tolerate carbohydrates coming into your system. In other words, what happens when you eat them? How does your body respond to them, and the insulin rise or fall? So I can't stress sleep enough for people. So what foods do we want to kind of limit in our diet? Well, some people would say probably all the good ones. So refined sugar. So refined sugar, the reason being is there's nothing to slow down the breakdown of it, right? So when sugar or like a soda or a juice or something like that hits our system, there's no fiber in it, there's no protein, there's no fat in it, right? So those three things slow down the digestion of a carbohydrate. So when those hit your system, there's nothing to slow it down. So you get an instant blood sugar rise. That's why diabetics can use these drinks to raise their blood sugar if they are low, because it raises it very fast. So a lot of times people don't think of beverages as having sugar in them or having calories. They kind of just think of them as something free. You really have to watch what you have coming in liquid wise. Also, some people think natural sweeteners like raw honey, maple sugar, agave, that those are free foods. They're healthy for you. So they're still sugar. So they're going to act the same way in your body. Yes, they have a few more nutrients to them, vitamins, minerals, but in your system, they act the same. Also be careful of artificial sweeteners like sucralose and aspartame. So we did not used to think that these would raise insulin levels, but they do. So diet sodas, sugar-free products, they will still have a lot of times an insulin effect. And the other big thing is that your body tasted sweet and it did not actually get the sugar, and you raised your insulin level. And so a lot of times you will keep craving sweet foods until your body gets them. So that's why people that drink Diet Coke aren't a lot of times normal weight. A lot of times they are still overweight because they keep craving that sweet taste. And so they're not satisfied. Processed low fiber carbohydrates. So all of our processed carbs lack fiber, once again, which results in a rapid blood sugar rise, and they also lack vitamin minerals, right? So your body doesn't feel satisfied from them. So breads, pasta, rice, chips, crackers, pizza, your baked goods, cereals. So some people think cereal is healthy. A lot of times it is not, because it's very high in carbohydrates and sugars. Potatoes, especially if there's no skin on them. All of these foods are what we kind of call a white carb. Once again, no fiber in there to slow those down. And so we like them because they taste good. And we also like them because they give our mind and our body kind of this quick energy, right? We eat them and we're like, oh, that tastes really good. And I also have energy for a short period of time. That's why we may also crave them when we're tired. And that's once again why a good night's sleep is so important. Also be aware of gluten-free products. So gluten-free does not mean healthy. A lot of times these are made with very processed grains, like a rice, a potato, tapioca starch, and these are extremely low in fiber. So just because it's gluten-free, a cracker or bread, or even there's gluten-free cookies, everything out there. A lot of times we still have to be aware of those. Look at the fiber content, look at what kind of flour they're made out of. So those are kind of the carbohydrates that digest really fast. You want to watch out for processed meats and low quality proteins, unhealthy fats, such as refined oils, vegetable oils, fried foods, baked goods, too much of these things. A lot of times these are the oils and the fats that are in our processed carbohydrates. So a lot of times chips are in vegetable oils. Sometimes even nuts are in like a sunflower oil. So I always tell people you have to look at the back. They really trick us with the front of packaging and say that it's healthy, it's natural, all of these things. It has olive oil, but when you look at the back, maybe olive oil is the last ingredient. So if you're eating foods, make sure that you're looking at what is the ingredient list on there, because they'll really try to trick you on the front of it. And the reason why we want to look at kind of these processed meats and the unhealthy fats too is because once again, those are a stress on the body, right? We have to look at food being a stress on our body too. And so they're not giving us the nutrients we need. And also when our blood sugars are high, it makes us more prone to heart issues as well, to high blood pressure, high cholesterol. And so we have to really watch those fats coming in. And then alcohol. Many alcoholic drinks are very high in carbs and sugars. So make sure you're watching those too. So the reason why, like I said, those kind of foods send us on what we call a blood sugar roller coaster. So they're going to have big fluctuations in your blood sugar. So if you see the orange line, simple sugars spike blood sugar levels, meaning that we may have a lot of energy crashes through the day. We have a lot of cravings for carbs or sugars. We fatigue easy. We might get hangry or lightheaded throughout the day. And we might just be like, even in the afternoon or after dinner, we might be like, well, I'm not hungry, but I'm craving something, right? I have to eat something. So let's say we started our day off with, let's say we had cereal. A lot of people think that Raisin Bran cereal is healthy and we put milk on it. So those would be carbohydrate-based foods, and actually Raisin Bran has tons of sugar in it. But it is what we call a whole grain, but there's a lot of sugar in it. And we also have to be aware that dairy has sugar in it too. So be careful of that as well. So let's say we had that for breakfast, very fast digesting carbohydrates. So it's going to spike your blood sugar up right away in the morning. Maybe mid-morning, you start to get a little hungry or tired, but you might grab coffee to get you to lunch. Lunchtime, you're hungry. A lot of times people have a sandwich and they have chips or sandwich and fruit. Once again, more carbohydrates, so you feel good, but around the 2, 3, 4 o'clock time, you get a big crash in the afternoon. You might see a lot of people that go like to the vending machine, or they get an energy drink or coffee to get them through the day. Sometimes if we start eating at that snack time, it's really hard to stop. We might have had intentions of having like a couple crackers, but we eat the whole bag of crackers. And then a lot of times what people happens, they walk in the door and they start eating before they even start cooking dinner. And then after dinner, sometimes they're still craving. And that's because of those blood sugar ups and downs. Sometimes people wake up in the middle of the night around a pretty common time, sometimes like around 2:22 in the night. That can also be a blood sugar crash a lot of times too. And then the whole cycle starts over the next day. And so what we want our blood sugar doing is, if you see that green line, you just want those smaller fluctuations throughout the day. That makes your energy a lot more stable. Your cravings go down. You feel much more in control around food. You get hungry at the appropriate times. You're not overly hungry. And then you don't overly stuff yourself either because you got so hungry. People say that, yeah, they just feel like they can concentrate and focus better. And they don't want to fall asleep at 2, 3 o'clock in the afternoon either. So that's what we look for with that blood sugar stabilization. And that goes much easier on the body. And you also feel a lot better. And this can be made possible just through changing your diet. So let's say for breakfast, instead of cereal, we had, maybe you had some eggs with some sauteed vegetables and some avocado. There's really no carbohydrate in that. So your blood sugar will just kind of stay where it's at. And then by lunchtime, you have, I don't know, just an example might be a salad with chicken and some olive oil, maybe a side of fruit. Maybe once again, just a balanced meal. So just a little bit of carbohydrate. And once again, you just kind of stay steady. There wasn't this big clump of carbohydrate or sugars coming in there. So foods we want to eat daily. So fiber-rich foods. The reason being is, once again, fiber slows down digestion of a carbohydrate. So that's why we want our carbs to be high fiber carbs. So 90% of the population does not get enough fiber in their diet. You need a minimum of 25 grams a day for your digestive tract to stay healthy, but also to balance our blood sugars. Your best sources of fiber are going to be vegetables, and fruits are great too. So the fiber is usually mostly in the skin of the vegetable or the fruit. So if you're eating an apple, don't peel the apple, eat the peeling. You'd rather eat the peeling and not the inside. So the inside is more of the starch part. Same thing if you have a baked potato, eat the skin. That's where all the nutrients are and all of the fiber is. So vegetables, we should be getting a vegetable at every meal. I say start with your breakfast, have sauteed vegetables with eggs. You can have them from leftover. You can put spinach in a smoothie, get some fiber in the morning, or you can use some low sugar fruits such as berries. So berries are going to be your lowest sugar fruit, highest fiber. Bananas, grapes, those are very high sugar, not quite as much fiber in there. Whole grains. So whole grains examples would be like wild rice, quinoa, oatmeal, farro. More people are eating these days. Beans are another really good source of fiber if you tolerate them. Some people don't tolerate them. And then nuts and seeds. have fiber, and you also see that those are a good fat too, along with avocados as well. Really good fiber, but also a very good fat. We also want healthy fats in our diet because why? Once again, fat slows down digestion. It's meant to make us full and it's meant to satisfy us. So when we eat fats, we actually release a hormone that tells us that we are satisfied. So if we're just eating high carb, low fat meals, we may not ever feel satisfied in our meals. I remember I followed the low fat diet back in the day when it was really popular. And I always wanted to eat. I was never full. I was never satisfied, even though I had enough calories coming in, but my body was looking for fats. And so really good sources are nuts and seeds, avocados, olive oils, your really good avocado oil, olive oils, coconut, fatty fish, such as salmon. You'll get some, like if you do eat red meat, like in a grass-fed beef, those types of things. You want to include a good fat at each meal. Thing is that fats add up very fast caloric wise. So don't just be taking handfuls of nuts, eating tons of avocados. There is calories still in there. We do have to watch the amount of them still. And then we want to look at lean protein sources too. So chicken, turkey, fish, seafood, game meats, grass-fed beef, small amounts of dairy. I say small amounts of dairy because there is still sugar and there is still a lot of saturated fat in dairy. And so we still want to watch that, but we can still have it in our diet, definitely. But it's kind of like nuts. It adds up very quickly. A serving of cheese is very small. You can use organic tofu, beans, lentils, high quality protein powders as well. And then there's other things that, apple cider vinegar. Lots of studies show that when eaten with meals, it does help control blood sugar levels. It's also very good for controlling good bacteria in our system. Cinnamon, also a great way. And we'll talk a little bit more about those. And then there's also something out there called resistant starches. So they're getting a lot of buzz lately. So a resistant starch is something that passes through your system undigested. And so examples would be if you cooked rice or you cooked potatoes and you let them cool and you ate them cold. They would not be a resistant starch warm. Another one would be green bananas. Maybe you guys have heard that green bananas not only have less sugar, but they're also resistant starch. So they don't raise your blood sugar as much as other starches would. And I can teach you guys more about those. I'm not going to get too much into those right now. So some people ask me all the time, well, what diet is best? Is it keto? Is it intermittent fasting, paleo, Weight Watchers? Do I need to eat 6 full meals a day? The reason is, or the answer is, it's really what's right for you. So I work really closely with individuals on finding, well, what's right plan for them? A lot of people don't want to eat 6 meals a day. That's very hard for them to pack up throughout the day. Keto, it can be very restrictive for some. And same with paleo. So it's finding, okay, well, what is that healthy balance that I can have in my day? And so I tell people, we really want to find a balance. So how do you build your plate? I tell people, first, you always find the protein source. So find your protein, whether that's chicken, turkey, it's tofu, it's fish, whatever that might be for you, find that first. And then add a vegetable. So we need those vegetables in there. So think of your protein as number 1, your vegetable as number 2. I don't care if your vegetable is cooked or raw or grilled or baked or roasted. I just want you eating the vegetables. So these would be non-starchy vegetables. And then I tell people add your fat. So you could add some olive oil to your vegetables. You could have a side of avocado. You could have a few nuts or seeds, or maybe the fat was like in your protein, such as like salmon. And then your carb is your side dish. It's not the main part of your plate. So when we have pasta, a lot of times it's pretty much 3/4 of our plate, right? Nope. So the carb should be the side, just a 1/4 of your plate at the most. And once again, use low glycemic or what we call high fiber carbs. So you could have some quinoa, you could have a sweet potato. Maybe you do want a piece of, bread there, or you want, some beans, something like that there. So it's really your choice. But I tell people, this is how you build your meal. And if you build your meal this way, we don't need to be counting calories every day, tracking our food constantly. And so this is how you build a balanced meal, and try to do all your meals that way, even when you eat out. So sometimes you're like, I don't know how to eat out. And I tell people, do it the same way. Find a protein on the menu and then build around that protein source. And you can interchange some stuff too. If it's a burger and fries, well, I tell people give and take on the carbohydrates. Maybe you want the bun and then you have a side salad. Or if you love the fries, you can have them at that meal. And then you eat your bun over or your burger over like greens instead. So it doesn't mean we can never eat carbs. A lot of times people just need to bring down the amount of carbohydrates they have in their diet. So with the food part, extremely apart, but then we also get into the exercise piece. So how does exercise help? So like I said, it helps improve blood glucose control, positively affecting your blood pressure, cholesterol levels, a lot of things. But the reason being is, once again, it uses up the cholesterol or the blood sugar that is in our system. And it also helps us because our muscles can store a certain amount of glucose as our blood sugar, a glucose as well, or carbohydrate. And so the more muscle we have, the better we tolerate carbohydrates a lot of times. And so we want to be building that muscle, not only for that, but also muscle helps with metabolism too. Helps with a lot of things. It also helps with our bone health. And so if we have blood sugars going up and down, that can also affect bone health a bit. And so we want to be doing that. We want to be getting active. We want to be moving. And like I said, also when we're moving, blood sugar levels stay more steady, because if we sit for too long, blood sugar comes up. This does not mean you need to go do high intensity HIIT training, interval training, that kind of stuff. If you're not working out right now, get out for some walks. They can be short. You can do multiple times around the block in a day, and then you keep building up. And so the big piece is that you're just starting to get active and you slowly build that up. It's a gorgeous day out today, so get out for a walk. And so it doesn't have to be something that's really intense or something organized, right? You can do a lot of stuff at home too. If you've never exercised or lifted weights before, I encourage you to meet with a personal trainer, just to make sure that form is correct and you don't injure yourself, and they can help you with that piece of things. And sometimes you just need, one meeting with them, even just get a plan to do at home. Just so you have a plan and you know what to do. Because sometimes that's all we need. We kind of get started and we don't know what we're doing, or what should I do today? If you have something to go off of, that helps out a lot, and they can kind of set a schedule for you as well. Also, supplements, there are some supplements that can help. The biggest thing though is to change your food and to start on an exercise plan. Supplements are meant to supplement any healthy nutrition plan. Magnesium is an essential nutrient. It is a deficiency that many people have now. It's our highest deficiency now that we do supplement vitamin D a lot of times. So it's involved in over 300 processes in our body, but it helps regulate blood sugar. It helps us with the insulin sensitivity piece. So magnesium can also help us sleep at night. It can also help with digestion, and it can also help with kind of muscle stiffness too. So there's multiple benefits to it, but I usually tell people to supplement magnesium, usually around 400 milligrams, usually around bedtime or in the evening. Cinnamon, like I said, I think that's spelled wrong. In the whole form or extract. So you can put cinnamon on your food. You can take cinnamon. It helps with that lowering of fasting blood glucose levels. Chromium is an essential trace element. It's used in the metabolism of carbohydrates. Vitamin B1 is also known as thiamine. So maybe you guys have heard of thiamine, but didn't know that it was a B vitamin. And so this one does not. So some B vitamins that give you a ton of energy, like the ones that are in energy drinks, and those can spike a blood sugar level. But this B1 is kind of known for, it helps you relax too. So many people with diabetes are thiamine deficient. And also if we drink a lot of alcohol, we will be thiamine deficient. Fish oil helps with inflammation, and it also helps to regulate blood sugars. And once again, it's a good fat. So that's how it also helps to stabilize. And so fish oil is something we do not get enough fish oil in our diet usually. We are those omega-3s. So most people need to be using a fish oil supplement. It's also very good for heart health. It's also very good for brain health. And so if you have joint issues, it helps with the inflammation there. Bitter melon extract helps lower blood glucose levels and regulates the body's insulin. So with the supplements, I don't get in too much details with these because they are individualized. So always talk with your healthcare provider before starting any supplements. They're not meant to replace medications or a healthy diet. If you guys have questions on supplements, you can always reach out to me if you're wondering what might be right for you, because supplements can be very individualized, can depend on a lot of things. So people always say, well, what can I start doing today? So diet changes, like I said, you don't have to do a drastic diet change. Maybe start taking out 2 processed carbs a day and replacing it with a veggie. Start to build your plate according to that plate picture. That will automatically drop some carbohydrates in your diet, and you will still feel full and you will still feel satisfied. So that's the key with the right plan, is that you feel full, you feel satisfied. The right diet plan is not one where you're starving and craving like crazy, okay? Because that's not maintainable going forward. Start to monitor your blood sugars daily and see what foods cause the biggest blood sugar rise in your body. It can be really interesting sometimes. And just sometimes people are number people, and that seeing that data really helps them. Watch what liquids you have coming in during the day. Start to get moving every day. Right now, if you track your steps and you're at 4,000, try to get up to 6,000, then try to get to 8,000. Take it slow. Or also make an appointment with a personal trainer too. And then don't sit for too long periods of time. Make sure we're getting up every 30 minutes. One thing that's usually a really eye-opening for people is to track their food intake for 1 week. Doesn't mean you do it going forward, but it's a good way to see what you really have coming in, as far as how many carbs do you have coming in, how many grams of sugar do you have coming in. Sometimes people don't realize how much they are eating, or also that some of the foods that they're eating that they thought were really good for them could be really affecting blood sugars and affecting their weight. And so, and then the other one that I forgot to put on there was to get your A1C checked yearly. And so I encourage you to check that. Sometimes you have to ask your doctor. We do labs at Odom Health and Wellness. So if you're like, I need to get my labs checked, feel free to come in and do that. You can call the front desk. We also do personal training here too. So if you're like, I need a plan, you can do that. And then I'd also be happy to help you out with any nutrition needs that you would need going forward too. Because like I said, diabetes can be very controlled through lifestyle factors, or pre-diabetes, turning that around through the diet that you choose to. So that is it. Does anybody have any questions? Any questions from anybody? Okay, well, if anybody thinks of any, there's my information, my email, and then the number for the front desk. So reach out if you guys have any questions. And this presentation will also be up on the website within the next few days. We did record it. And so if you want to rewatch it or send it to somebody, feel free to do that as well. Thank you.